Hi, everyone. Thank you. Hello and good evening. I'm Maria Fuertes, and I'm the director of the Practice Heroes program at CareStack. Thank you so much for joining us this evening for the second episode of our series, Dinner with the Practice Heroes. These events are held each month, and you get to hang out with us, the Practice Heroes, along with special guests, where we'll share with you real insights from the dental practice, as well as tips and tricks, pearls of wisdom, best practices, sharing our knowledge from the trenches to help you be more efficient, optimize your day-to-day operations as well, clinically and administratively. You're working smarter, not harder. And since we're taking up your dinner time, we want to make it up to you by gifting you with a $25 DoorDash gift card. So wait till the end of our program. We'll be sharing the special code with you to get your $25 DoorDash gift card. And one other thing, I'd like to mention something. We'd like to ask our audience, what topics would you like us to cover? I actually had someone reach out to me recently and they asked, can we talk about the real stuff? Like the real stuff that goes on day to day in the dental practice? Talk about what's working, what's not working, and then talk about the elephants in the room. And I was thinking to myself, like, well, of course, most definitely. That's what we're here for, your resource. So send me your suggestions on topics, requests, feedback. We would love that. Email us at practiceheroes@carestack.com. And then Crystal, I was wondering if you could put that in the chat for us.
Okay.
Yep. And if you want to know more about the Practice Heroes, email us again at practiceheroes@carestack.com. Okay, so I'm going to go ahead and try to share this because I know that, Alicia, you're having technical difficulties, correct?
Yes, I'm in on my phone now.
All right, I'm sorry to hear that. Let me do this. Oops. All right, can everybody see my screen?
Yes, I can see it, yes.
Okay, awesome. So first and foremost, thank you once again for joining us today. And we've got some great topics today. What's the reason why we all came about to join at this evening's meeting is that there's so many things going on in the industry, but always, accounts receivable, insurance is such a hot topic. But before we do that, I'd like to kick it off and I want you to meet our panelists. So let's take it away. Alicia, you want to start? Oh, Alicia, you're on mute. There you go.
Sorry, technical difficulties. So I'm Alicia Gerard. I am based out of Utah. I have been in the dental industry for 11 years. I've spent the last 5 years, actually that's 6 years now, as a dental office manager. The past 2 years, I have been a CareStack user, and the past 5 months, I've been part of the Practice Heroes program.
Thanks for that, Alicia.
Yeah.
Okay, hi everyone. I'm happy to be here. My name is Christy Chavarria, and I've been in the dental field for 27 plus years. I grew up in the field starting as a dental assistant, and I've grown into some management roles for the last 22 years. I've managed both multi-group practices and large private practice settings. So currently I'm managing in the Buffalo, New York area, and I've been a part of Practice Heroes for 5 months now.
Thanks for being on board, Christy.
Thank you.
Hi everyone, I'm Crystal Beal. I've been in the dental industry for the last 7 years. I've worked for several DSOs in Southern California, where I was leading the multi-specialty program, and I'm excited to be here with all of you tonight.
Thanks so much. I think, Christy, you beat us all. You know, you literally like grew up in the dental industry, so I can't beat that.
No.
All right, so I just want to get to the topic as to not sure what's happening here. Really having technical difficulties. There you go. I'm gonna try to do this very quickly here. All right. What's the reason why we're here today? Well, we want to share with you why there are benefits from checking benefits, right? So before we review the topics on tonight's event, I want to first talk about what's the reason why you want to check the benefits, for your patients. And many things are happening actually. Upon working with clients and hearing from the colleagues in the industry, AR, accounts receivable, insurance aging has been a challenge. It's a lot of the time, especially with the climate as what it is now with respect to talent acquisition, meaning that you're trying to find the people that you need to cover the spots that you've lost, people during COVID, you're shorthanded. So it's affecting people in many, many ways. In fact, just to let you know that there are more companies out there that are offering services strictly on insurance billing, benefit checking, and keeping up with AR. I'm sure that there are those of you on the call today that are actually utilizing those services. And for our CareStack audience, we do have an RCM service, just like what I've mentioned. And please email us tonight, and we can definitely point you to the person that you should talk to about. So most definitely check us out. So there are constant challenges, especially with AR. Many of you may already know this, or perhaps you are new to the dental space. So one of the things that I've experienced, it's important to create systems and processes in your practice when it comes to insurances and accounts receivables. You can create a problem that you'll be playing catch up with for quite some time. And I know that the ladies on the panel today can speak to that. When I've been asked to help turn around practices or groups, I always do a temperature check with the accounts receivables first. Most of the time, this tells me the areas of opportunity and where I find busts in the systems. When there are major problems with AR, most of the time it leads me first and foremost to verifying benefits or lack thereof. So there's usually a disconnect in that. However, there is more to AR and more to benefits, and the practice heroes will walk you through this. So what are the benefits from checking benefits? Obviously, verifying your patient's benefits accomplishes many things, but most importantly, like we have in our slide here, your patient's care comes first, okay? A couple of things, it definitely creates trust and transparency. You have happy returning patients, and you have patients that basically say, you know what, these people do care for me, and whatever you're presenting in estimates, there's no way around it, and guessing or taking out that what's it called, that copay calculator that some of us may still use today. Let's get out of that. Let's enter in the fee schedules, and let's increase case acceptance, and let's keep our schedules full. Let's take care of those patients, and most importantly, let's decrease insurance and patient AR. And the team tonight is going to talk about it. So here are our topics. We're going to talk about eligibility first, exclusions and limitations, primary, secondary benefits, plan, fee schedule, assignment. Some of the things that people out there talk about, but don't really know the importance of that. So without further ado, I'm going to go ahead and I'm going to throw it out to you, Crystal. Let's have you talk about it.
Sounds good. So when it comes to checking eligibility, I've been in your shoes. I've been a treatment coordinator, and I know it's a very daunting task. It's not something that we want to do, but it's definitely an important thing to do prior to the patient's first visit. We want to make sure that we're being proactive. Staying 2 to 3 days ahead is going to allow you time to make any corrections if needed, but you want to make sure you're gathering all the correct information, such as the patient's first and last name, the spelling, their date of birth, their member ID. All of that is going to determine you getting the correct breakdown. And then also, I worked in an office where we have several doctors and several hygienists working in one day. And so if we're not ahead, we're going to be falling behind. And that if we fall behind, that leads to patients waiting, unhappy patients, and then they're not going to trust us. They're not going to feel like we're being, taking care of everything before their appointment. So it's definitely an important part of the patient's first appointment.
So basically, patients want us to be upfront, right? They want to know, the consumer behavior wants to know what they're paying for services being rendered, right?
Exactly, Maria. Yeah. We won't be able to give them an accurate quote, or when a doctor is diagnosing the treatment, we want to make sure that we're giving them the correct information so they know exactly what their out-of-pocket's going to be. There's no guessing.
I like that, not guessing.
All right, so if we're not getting the correct information, this results into a few different things. For one, it's going to be the incorrect estimates. And this goes back to the patients trusting us. So if we're not giving them the accurate information and they get some major work done and we have to ask them for more money, of course, they're not going to be happy. This is not going to be a good result. Denied claims is another one. We know once the claim is submitted, anything, it could take up to 60 to 90 days. And if we're being productive in the office, we want to make sure that we're getting paid in a timely manner. It increases and makes you have inaccurate AR, and then you have unhappy patients. No, they don't trust in you. They don't trust in your practice. And we know these days, everybody goes to Google and Yelp, and if they don't have a good experience, they're going to tell 20 people, everybody's going to see. So we want to make sure that we're doing everything that we can so the patient has a good experience.
Right. I know of a story of a practice at one time where, you know, they had those types of issues where they really didn't check for eligibility and benefits. And I've actually seen reviews where, I mean, a patient said that they were shysters. I mean, and it's so hard to get out of that 1-star review, right? I mean, that's a whole different event in itself, presentation itself. But the fact is that, you know, you want to be proactive. I think that the tone that we want to talk about here is, number one, patient care first and being proactive. You also talked about getting all the demographics. I can tell you enough times where I've seen, and I'm sure you have too, Crystal, you tell me if I'm incorrect, seeing claims go out without demographics, you know, licenses and what have you, dental licenses, and what normally happens in that.
Yeah, I mean, even if a patient say their date of birth is wrong, or even a spelling is off on their name, that's going to push the claim out. That means we're not going to get paid right away. So all of these simple things are very important when gathering that information.
This is important.
Right. Yes. And then you always want to ask if there is a waiting period when getting the breakdown from the insurance representative. This is going to affect their coverage and the services being rendered, if they have coverage or if they don't. Christy will touch base on this later on in the presentation. And then when it comes to pre-treatment estimates, in the office that I worked at, we generally didn't do pre-estimates. But I know that Christy and Alicia, I believe you guys can touch base on this a little, right?
Yes, for sure. My office, we do a lot of pre-treatment estimates because we take a lot of Medicare Advantage plans, and those plans actually require pre-treatment estimates for anything over $300. And then anytime I'm doing like an anterior cosmetic case, or, you know, even if it's an anterior crown case that has nothing to do with cosmetics, I always do a pre-treatment estimate, just because you just never know how picky an insurance is going to be for a reason for a crown.
I'd also like to point out something that Teresa Duncan points out as well with respect to verbiage. You know, pre-treatment estimate. How many times have you heard throughout your lifetime in the industry having the term used as pre-authorization? Yeah, that's very common. And what do you mostly get when that happens? Patients automatically think like, well, if it's denied, then I'm not going to get it done because my insurance told you guys not to. So we got to change that mentality. And I love that we have this on the slide. And also, you know, one of our foremost trainers out there with respect to insurances, like Teresa, I know that she talks about this all the time, but it's important that we change that vocabulary. So, you know, we don't want to have the insurance run the practice as well. And this is just even having a change in verbiage can definitely change the outlook and how the patient receives insurances. So I know that we have a lot of industries out there, or excuse me, practices out there that also take Medicaid. That's very important that, and Christy, I know that you had a practice that was taking Medicaid, correct?
We did. And with Medicaid, you definitely want to make sure that you're checking the eligibility the day of the appointment. So Medicaid requires same-day eligibility. So a way to make this so that it's not an issue in the office, you want to try and have an employee there prior to your schedule in the morning, I would say probably at least 30 minutes before you start the day. So they can check all the eligibility, and then if someone's not eligible, unfortunately, you're going to have to reschedule that appointment, and then hopefully we can get those appointments filled so we have a productive schedule. So with Medicaid, they're very particular about that. So
obviously with a Medicaid business model, you got to be prepared and be proactive.
yes.
If the schedule does fall apart, that you have a short call list to pull from.
Right. Exactly.
All right.
All right, so I'm going to talk about eligibility within CareStack. CareStack has this super nifty feature where it will check eligibility for you electronically, and it does it through the Change Healthcare Clearinghouse. So here you can see the blue arrows pointing to a little yellow button. You just click on that, perform electronic eligibility. It's going to populate something up, and it's going to tell you, when the plan was eligible. It'll give you a term date sometimes on there if it's not eligible, or it'll just give you an error saying the patient can't be found. That means that either the plan is termed or you need to double check your demographics for your patient. The name could be wrong, the birthday could be wrong. Even something as simple as the patient's address could be wrong and throwing it off. And then some of the breakdowns will also, instead of just giving you eligibility and a possible term date, some will give you the full breakdown that you would get either on an insurance portal or on an insurance fax. So super, super helpful tool. I recommend that absolutely everybody use it who's using CareStack right now. And then this is just going over how you can spend more time in your practice and less time on insurance portals and on the phone and all that. After you get your eligibility put in, you can kind of break it down in CareStack. You can enter in waiting periods. You can see here the example, I've got certain waiting periods on certain code categories, and that is going to make it so that your treatment planning is correct. In the past, when I've been on previous practice management softwares, I just had a note area where I would enter in how much a waiting period was, or when a waiting period was going to be up in a certain category. And then I would have to just manually remember and manually calculate that when I was presenting a treatment plan. But the beauty about CareStack is you can just put in, the waiting period is X amount of months for basic and X amount of months for major. That way, when you're calculating that treatment plan, it's already going to factor that in for you.
I got to tell you, with respect to waiting periods, just like you said, it's awesome that we have this, system within the system, right? But also, once again, for those of us that are not in CareStack, and if you're interested of checking us out, definitely wait till the end. We'll give you some information how to reach us. However, though, going back to the waiting period, I got to tell you, when I first started out in dentistry, actually in ortho, it was really important for me. I found out the hard way when I didn't ask for that waiting period, and it was a year's worth because of the employer, what they negotiated with the carrier. There was actually a 6-month waiting period, and I started this child's orthodontic treatment. So needless to say, it was a really tough conversation I had to have with the parent, letting them know that they should have waited the 6 months, or it was my mistake. The $1,000 is not going to be applied, and there's no way that I could have taken the braces back, right? So, I mean, lesson learned. Those things that we do that got us into this, and how we're sharing this with you. We don't want you going through what we went through. So, pearls of wisdom here, folks. Yeah. Pearls of wisdom here, folks.
Yes.
Yeah.
Okay, so this is another deep dive on the eligibility and benefits section in CareStack. So I have circled here at the bottom an example. A limited exam is generally under, diagnostic, which is on this plan 100%. But the specific limited evaluation code, the insurance actually covers it at 80%. So they cover it as if it was a basic procedure. So you're able to come in here and add specific codes in, put the percentages, you can choose if the deductible's waived or not, and then you can also enter in, whatever waiting period is associated with the basic category, because this code, according to the insurance, is treated as a basic category. So just another nice thing, because I know, especially with the one thing I see the most is occlusal guards. Technically, it's under a basic category in the miscellaneous section, but a lot of the times insurances will cover that as a major service if they cover it at all. So this is where you can enter in those type of codes. Then you're just doing a lot less manual calculation. Just super, super handy that CareStack has this feature for us.
Once again, being able to present the correct fee estimate, right, to the patient.
Exactly.
Right.
Yep.
All right, Chrissy, this is your wheelhouse, and you've got a good story for this one too.
Okay, so we're going to go over exclusions and limitations. So preventative would be our first category. So you definitely always want to find out your exam frequency. So for instance, your comprehensive exam, normally that would be covered with most insurances one time every 36 months. But you also have to ask the question when the patient last had that benefit, because this is your initial exam with you, and they may have saw another dentist, 2 years ago, and it may not be a benefit. So you always want to ask that question and look at their history in regards to that exam. And then you've got your periodic, which would be your recall exam, and your limited exam. So you want to ask the question, these exams are normally covered either every 6 months, or they're either covered twice in a calendar year or fiscal year. So those two exams most likely are going to share a frequency. So a simple example may be you have a patient who comes in January, gets a checkup appointment, they utilize an exam, then they're back probably in June or July for their next 6-month recall. And let's say they come in at the end of the year and they have a toothache, and that's going to be a third exam. So you want to make sure that you're asking that question, because obviously that patient is not going to have a benefit for that third exam. And that's going to end up being out of pocket for them. So if you can collect that prior, to their visit, or let them know on the way in, unfortunately you don't have this exam coverage, and then we can get it collected at that time.
And do you find that to be a challenge when you're having to present that to the patient? Because most of the time, the expectation is that they're supposed to know what their benefits are, but 100% of the time they don't. So do you find yourself having challenges in having to explain this, or are they having challenges understanding it? Perhaps?
It can be challenging, because this is kind of considered a preventative thing. And most people think, oh, I get free cleanings, and I get free office visits and that type of thing. So yes, and if you don't check these guidelines, lots of offices, I know they end up, adjusting things like that, because it's courtesy, x-rays and things like that. And so we want to try and stay away from that so that we can be collecting those monies for the services.
And that's money's lost.
Exactly. Yeah. And then you're going to kind of have the same scenario with your pro fee. I know I will at the last slide. There you go. Sorry. So pro fee is kind of the same thing. You want to find out, is a pro fee going to be covered every 6 months, or is it going to be covered twice in a calendar year or your fiscal year? And pro fees can share frequencies too. They're going to share a frequency with what we call a perio maintenance. So an example may be if you have a patient who has their teeth cleaned 4 times a year, they need to understand they're only going to get a benefit for most likely 2 cleanings that year. So again, you're going to have to be quoting them and collecting, prior to that, those additional cleanings.
Do you find educating your patient is obviously being proactive?
Yes, most definitely. If you can go over it with them first and they're not surprised, they're not getting a EOB in the mail denying the service, they're already aware of it, and it makes obviously, as we're trying to build trust with them. So now we'll look at the basic and major categories. So
this is my favorite.
Yes. So we always want to find out if the insurance covers a downgrade or not. So they call it an alternative benefit. So what this means is, let's say doctors diagnosed a composite filling on a posterior tooth. Okay. The insurance, when you're asking if they cover a downgrade, it's going to mean, are they going to pay for that composite filling, or are they only going to give me a benefit for the amalgam filling? So pretty simple example would be, let's say our filling is $100. If they cover a posterior composite, the patient pays $50, the insurance pays $50. That's pretty simple example.
Basic.
If they don't cover posterior composites and they're only going to give you a benefit for amalgam, let's say the amalgam fee is $80. What ends up happening is the insurance is only going to pay $40. So then that patient has to make up the difference. So ultimately their out-of-pocket would be $60.
So ladies in the panel, do you happen to know or have experienced, I'm sure you do know, that having to explain this to the patient, it's hard for them to, grasp, right?
Right.
Yeah. So I'd like to know, Alicia, Crystal, I mean, what do you normally say to a patient when they have benefits of this nature?
I always try to let them know it's more of an upgrade or aesthetically pleasing to the eye, you would say. So you just let them know it's a better material, it will last them longer, and again, aesthetically, it looks nicer. So most patients want, to look good, so they'll usually go with the upgraded option. That's how I explain it.
Mm-hmm. Alicia?
Yeah, I always like to throw it back on the insurance. So when I'm explaining it to a patient, I'll just say, those old silver fillings that you probably had as a kid? Well, the insurance is only going to pay for that, but it's 2021 and we don't do that anymore.
Right.
So we do the white filling, but they're not up with the times. They're not going to pay for it. So you're just going to have to cover the difference, but it's only this much. And the patients are like, oh my gosh, stinking insurance companies. I'm getting my patients to roll their eyes with me at insurance companies, and it's very great.
Yeah.
and a lot of doctors won't even do a silver filling anymore.
Right.
Correct.
And then you just have to, explain that to them too. Unfortunately, that's not even an option here, but so.
Correct.
Now, as far as crowns, you're going to run into the same scenario. It's the same thing. You want to find out, is that insurance company going to pay for a white crown or a porcelain crown versus a metal crown? And it would be the same exact example that they have to make up that difference. So that's what you would want to ask with crowns. And another important question to ask with crowns, you always want to find out how often they'll replace an existing crown. So it's really important. Normally the waiting period is usually 5 years, but now insurance companies are going anywhere from 5 to 7 years and even 10 years.
Oh, wow.
So that's, yes, 10 years, it's out there, believe it or not. So if that patient has that crown and it was made less than, let's say, 5 years ago, unfortunately, they're not going to get a benefit. So that's important. In our office, we have them ask that chair side. They'll ask right in the operatory, doctors diagnosed that we need to replace this crown. How long ago did you have that crown made? So if it's the same insurance, the insurance will have a history. If not, you just have to take what the patient says and then, proceed with the quote with that.
You have a personal story for this, right, Christy?
I do have a personal story when it comes to prior extractions. So we'll jump into prior extractions. Okay. So what a prior extraction is when you have a tooth that's missing, if you were missing that tooth or it was extracted before you were eligible on this insurance, some insurance companies are not going to pay to replace that missing tooth, whether it's a bridge or whether it's a partial. So you have to ask that question. Do you cover prior extractions or don't you? So I learned the hard way with this also, just like you, Maria. When I was early treatment coordinating, I had done chairside, but I didn't know all these rules or anything. So I went ahead and quoted the patient, oh, they're going to cover your 3-unit bridge. You're going to get 50% coverage. Well, they didn't cover prior extraction. So unfortunately, I had to call the patient, and the doctor I worked with was pretty adamant. And he said, Christy, you're going to learn this right from the beginning. And I had to call this patient, they weren't happy, and make arrangements and make sure that I collected those monies. So that's a definite question all the time. You always want to know about prior extractions.
And that's also, somebody's got a reverberation there, but that's also a common mistake people make. And it's not because we don't want to make that mistake, but
right.
You're on hold with the insurance company for such a long time, you want to get off, or you don't really get a full detailed breakdown. Those things are missed. And then there are more people having to have those uncomfortable conversations with the patient. And there's other practices where, maybe the doctor will say, okay, we'll just write it off. And that's hard for me to take, because here you have the doctor, producing and all the, salaries that, that the assistants, keeping the lights open and the materials, it all adds up. Then, I've seen and heard this happen as well, where they would write things off because they made that mistake. So let's say that if you did that once a week, Christy, like the $1,000 bridge or whatever it was, That's like $52,000 if you annualize it, right? Once a week.
Yeah.
That's a lot of money. But for those that may do it all the time, it definitely adds up.
Right.
So yeah. All right. Awesome. Thank you for that.
You're welcome. So on this slide, we're just talking a little bit about upgrades. So upgrades are going to be, for instance, if you have, let's say, a high quality crown, which we have listed here, or if maybe the patient wants to add a porcelain margin, maybe to the crown, so that, you know, aesthetically you're not seeing, well, that's kind of doesn't really happen anymore because we mostly do porcelain crowns, but it would be any kind of item or material that you're upgrading that the patient is going to have to pay above the actual insurance fee. The insurance is most likely not going to pay any of these services. If you're going to have a partial made, a lot of times people have Val Plus partials now, and that can be considered upgrades. So these things definitely would be the patient's cost. You wouldn't be getting an insurance benefit out of this.
So I can tell you this, that I've had some doctors ask me that they didn't know that they can actually do upgrades.
Right. They didn't realize it.
Right.
Yeah.
So they can, but the patient just has to pay the difference, correct? That's what you're saying?
Correct. Correct.
All right.
Yes.
Very good. Oh, here's that missing tooth thingy.
Yes. Well, we kind of already went over this, but another
Right.
another thing that you want to ask, if the rule of thumb is, so if you've got multiple missing teeth in the same arch, and normally the rule of thumb, if you have 3 or more missing teeth in the same arch, there's no guarantee that the insurance company is going to pay for a fixed appliance. So if you want to do a bridge on the upper left, but you've got missing teeth on the upper right, they may only give a benefit for, let's say, a partial. And there's a big difference between the benefit of a bridge and a partial. You know, you could be paying, the insurance might pay $400 as their percentage on a partial, and they may pay $900 as their percentage on a bridge. So if you've got congenitally missing teeth on each, you know, missing teeth on each side, you need to ask those questions. And you should be able to ask the insurance representative on the phone if you're going that route, and then you can hopefully try and not have to pre-authorize, like you were talking about, Maria.
Or get a pre-treatment estimate.
Right. So, and then I think Alicia's going to show us how we take all this information and put it into CareStack.
Yep.
Yay. Okay, so this is the exclusions and limitations section of the insurance and CareStack. And I just kind of showed a snippet here. This is just an example of the diagnostic areas. But CareStack has that ability to actually enter in per code or group of codes what the frequencies are. You can also put in certain limitations and exclusions, and I'll give a few examples. So here you can see listed, you know, exam, x-rays. So you can put in how often the exam is covered. Is it twice a year? Is it twice a fiscal year? Is it once every 6 months? Is it once every 12 months? For things like fluoride, it allows you to put in, you know, fluoride is covered, let's say, for example, twice in a calendar year, but only up to the age of 16. So that way, when a patient's coming in for hygiene who's over the age of 16, CareStack automatically calculates that they have to pay the fluoride. The patient pays it out of pocket. Another exclusion, just as an example, is you can put in that a rest-in is only a covered benefit if it's done with a perio maintenance rather than a pro fee. And then, yeah, it gets very detailed. Another exclusion I've seen in there are denture adjustments will not be paid for by the insurance if it hasn't been at least, you know, 6 months or 12 months after the denture was actually created itself. So lots of lovely details that normally you would just have in a note section that you had to kind of go look at, that you can
don't have to anymore.
CareStack. Yeah.
Right.
Super, super nice. And then this slide is just going to show the example of how you can apply downgrades in CareStack. Before CareStack, I was in Dentrix, and I know in Dentrix, I had to put a dollar amount. So I had to calculate it myself and put a dollar amount in there. So every year, if your fee schedules go up, you have to change all the downgrade dollar amounts as well. And that is such a headache, especially when you have 900 plans in your computer system. So here you can just put, you know, the example I've got here is the 2740 is going to downgrade to the 2791 on the posterior teeth. So it's just automatically going to pull the fee from the fee schedule on both of those. calculate the patient's benefit correctly so that the patient makes up that difference.
It's a great feature.
And then, then you can also do that for the posterior composites as well if they downgrade. So that's just what this example is showing you. That way your patient estimate is always going to be very accurate when it comes to downgrades.
This is important because I used to get questions all the time, like which one's first?
Definitely.
Yep.
Yeah.
You have the wife call and say, I'm going to use my husband. You know, they make that decision for you. And you're like, no, that's not how it works.
No.
Right. All right. Let's hit it out of the ballpark here.
Yes. Primary and secondary insurances and their benefits. So I have some rules listed out here on this slide as well as the next as to when one insurance is primary and when it's in secondary insurance. So most common rule that most everybody in dental knows about is the birthday rule. If you have a child and the mom has the insurance and the dad also has a policy, of insurance, whoever's birthday out of the parents comes first in the calendar year, that's the primary insurance. The other one's the secondary. Now, state and federal plans, that's going to be like your Medicaid and Medicare. Those always fall secondary. We have, if a patient has 2 employer policies, let's say somebody's crazy and they have 2 full-time jobs and they get benefits for both jobs, whatever insurance has the effective date first, that one is going to be the primary.
What happens, Alicia, though, let's say they didn't have 2 full-time jobs. How about if they landed a job, but prior to that, they purchased their own insurance and kept that, but then also now decided to take the dental insurance plan from their employer? How does that looked at?
I'm 99% confident that the employer plan is always primary.
Mm-hmm. Okay.
I think that's correct. Yes.
Yes.
All right.
And then we also have HMOs that throws a huge wrench in any of the rules. I am not super familiar with HMOs, but I know both Crystal and Christy are. So can you guys kind of touch on how that works with the benefits?
Yeah, as far as the HMOs, Alicia, so the way I explain it to patients is HMOs don't generally pay towards the treatment. You're getting more of a discount. So for the patient to see the value in having the insurance or the HMO plan, you want to show them the UCR fee, which would be the cash fee, and then show them what their contracted rate is. So say for an example, a filling, the cash fee is $500, but the fee with their insurance is $300. You're going to want to show them you're getting a $200 savings pretty much. So that's where you're going to see the value in having that plan.
So I know that you keep seeing value, Crystal, and I know that a lot of our clients that we work with and people in the industry may not take HMOs. But given from my experience, I also had a couple of offices that took HMOs, and it's only because of the region that they were in and the huge employer groups that surrounded those 2 to 3 offices. And
Correct.
That's why we took the HMO plans.
Yes, correct. And where I worked in Southern California, all of the major employers, people who work for the government, the police department, they all generally have HMO plans. So we see them all the time in my region, definitely.
Right. And obviously if the PPO is secondary and the HMO is primary, we basically want to make sure that we attach the HMO fee schedule to the claim.
Correct. The PPO insurance is going to want to see that so they can determine what they're going to pay towards the services that are rendered.
Got it. Okay. So this is just a great list that Alicia has actually put together for us, and we'll be happy to share the slide deck, if you will, to those participants, the attendees, because insurance, just the topic of it all, we can be here all night. So we're not going to do that to you, right? We're already taking part of your dinner time, so I don't want you to kill me after this. But anyways, this is a list, Alicia, if you can explain what this list is about.
Yes, so this is the second half of rules. If there is a medical insurance involved that pays a little bit on dental benefits, the only ones that I've seen that does this are the federal plans. The medical is always going to be primary. FEHB stands for Federal Employees Health Benefits. So those are, you know, your government and your military employees. Those plans are always going to be primary. And then for the same group of patients, they also have access to FedVIP, which is Federal Employee Dental and Vision Insurance programs. That is always going to be secondary. The slide says primary, but it's supposed to be secondary. COBRA, that's if an employee terminates, you know, their employment with someone, or if they get, you know, fired, and they still want to hold on to the insurance, they are allowed to hold on to the insurance, the group insurance policy, but they have to be paying more. They can pay all the way up to 102% of the entire premium, rather the employer paying anything towards the premium. Right. So that, if, you know, it's not super common, but if that happens, that is always primary with another insurance.
So in this slide, Alicia, I think everybody knows about standard and non-duplication and do not coordinate benefits, but can somebody talk about the maintenance?
Yeah, we're actually going to talk about that in the next slide.
Awesome.
So if you want to go back to the previous slide, we've got AFLAC. Those are those policies where if a patient has AFLAC and you choose to bill it for them, then that is always going to be secondary. And the benefits do not coordinate. Frequently, there is an overpayment, and that overpayment will belong to the patient. So you don't need to do an adjustment in your system to make the balance zero so that there's a credit. There's supposed to be a credit if there is one. And then last but not least, if there's a divorce decree in there, that can completely override all of the rules that I've talked about. Right. Divorce decrees just triumph all.
So AFLAC, once again, if there's an overpayment, it doesn't belong to the practice or the provider, it belongs to the member.
Exactly. So they can either choose to keep that as a credit on their account for future services, or, you know, they can choose to have it refunded to them, because AFLAC was built for the patients to bill the insurance. But where it's just a click of a button for you to bill the insurance, you might as well just do it for the patient. That's how I look at it. And my patients that have AFLAC are very grateful that I do that for them. Okay. So yeah, here we're going to talk about the types of coordination of benefits. So most common, standard, that allows the patient to receive up to 100% from both insurances. So say you're doing a Crown, primary pays 50%, secondary pays 50%, they can pay all the way up to that full 100% combined. The third one down, non-duplication. That is if the primary ends up paying more or the same as the secondary would have, then the secondary is not going to pay anything at all. That one's pretty rare. The last one on here, do not coordinate benefits. The secondary is basically going to be a completely useless policy unless the primary maxes out. They just won't even touch it.
So in this case, once again, with respect to verifying like the benefits from checking benefits, right? We either have to ask these questions. Hopefully everybody has that insurance, you know, log or paper, if you
breakdown.
I'm sorry, I can't talk about it anymore because I'm in CareStack. I can't take, you know, like I'm in CareStack, everything's electronic, it's right there. So yeah. I just remember that sheet. So you gotta have to ask those questions. Now I know that dental insurance is like, you know, a fax or email benefits. Will it have this information on that?
Absolutely not. You have to almost always ask this.
Right. I think that a lot of times people rely on those, and unfortunately they don't get the information like they're supposed to. Right. So.
Yes, definitely.
So because of time frame, Alicia, do we want to talk about maintenance? Because I know that when we were talking about this the other night, people didn't like, what is a maintenance, you know?
Yeah, we'll just skip it because it's something you're probably never going to use. You'll see it in CareStack. That's on the next slide. Just a screenshot. And it's an option, but it's a very, very rarely used option.
Correct. All right. So this is my wheelhouse, right? Plan fee schedule assignments, or actually entering in plan fee schedules into the system. I enter this in here myself. It's worth the time and effort. You know, I know that it takes a lot of time. It takes a lot of management. It's a little bit of management, but at the end of the day, like it says here, it produces huge benefits. And I can tell you, I'm amazed at times on how many offices don't know this feature exists in their software, whether they're in the legacy right now or in CareStack, it's there. So for setting up and managing fee schedules, you're in one of those offices. If you're in one of those offices that you can set it up, it's time to check it out and use it. You'll be glad you did, and your patients will be too. So this is the preferred method, of course, for offices that work with multiple PPO plans. Most importantly, though, it's important to know the fee schedules with the in-network insurance plans. We actually had this in our From the Ground Up series. It's those umbrella plans that we're talking about, which is Dentamax, Carrington, and Connection Dental. So here are the advantages, right? You know, fee schedules system is the preferred method. Like I said, with this system, the office team must keep the fee schedules current, update the coverage table accurately, and I would say annually. One of the great things that CareStack has, and I know I keep going back to CareStack because I myself had been one of those people that had to wait until like, you know, 11:59 or midnight of the next
December
year.
31st.
December 31st of the next year to enter in my, you know, my increased UCR fee schedules. Yes. Or if I received a letter from the insurance company that, surprise, you know, there's some codes that they've actually increased, which is a great thing. You know, I literally had to go in and wait till everybody, you know, logged off and had to enter their stuff in. And if I had 10, 12, or even 25 offices, guess what? I had to do that individually. With respect to CareStack, you just go into the into practice settings, you enter in the fees that are being actually increased and the date that it's being increased, or effective date, if you will, and it does it all for you. You can leave it at the end of the day and it does it like lickety split. So I don't have to work, you know, before midnight or after, or waste my New Year's Eve, if you will, and or wait till the evening. So yes, you know what's truly collectible. Adjustments are calculated up front rather than waiting to make adjustments after receiving the insurance payments. You know the true production because no production adjustments have to be entered after the insurance pays. It makes it very easy for you. I gotta tell you, fee estimates when you're presenting the treatment plan. I was just working with a client and it's night and day with them, night and day. They're able to now trust what's in the system. They feel confident in presenting to the patient. The patient is very informed. They know what's expected of them at time of services. So when there's statements that are sent out, it's not a, you know, like a question, if you will, and you can send out statements real time. All right. Okay. So we're going to have dear Alicia show us what this looks like. This is about fee assignments. This is another important part too. Don't skip this one. Go for it, Alicia.
All right. So this is just a little snapshot of how you can attach the fee schedules in CareStack to the insurance plans. If you have multiple locations, multiple providers, even multiple specialties, and you have different fee schedules for all of those, you can actually assign that right in here, which is super nice. I myself come from a small office. We're one location, one doctor. So that's why my example only just has those first two. But that is just a super awesome feature that CareStack has, especially for those large DSOs and multi-specialty practices.
Also with practices that may have 2 to 3 locations as well.
Oh yeah.
Even one location, it's a huge game changer. It makes you become more efficient and you can optimize your day-to-day.
Exactly. Right? Sorry, my phone is lagging. Are you on the next slide?
Yes, I am.
Yes, she is.
I was like, I can't see it yet. Okay, so this is just a snapshot showing you where you enter your fee schedules into the CareStack system and settings. As you can see, I have my example, Humana, Cigna, Aetna. And then CareStack also has the ability to break down the fee schedules by type. So I just took a quick snapshot of the different types. You can put in PPO, you can put in HMO, you can put in Medicaid, Medicare, indemnities, copay plans or even discount plans, whether that's from an insurance company or in-house. And on the schedule, on a patient's appointment, one of these is going to be on there. So you can just quickly see, you know, oh, this patient has a PPO, or oh, this patient has a copay or a discount or whatnot. So just super, super nice how CareStack just really lays everything out for you, makes it so easy and streamlined. That way things aren't getting missed. They're not falling through the cracks. It's just an amazing system that we get to work with.
All right. I think that we've overstepped our dinner time with our audience, and I want to respect that. I think there's something in the chat. Let's see here.
I think it was Jim.
Great insights. All right. Thank you, Jim.
Thanks,
all right.
Jim.
So best practices and takeaways. Once again, it's important to obtain all the insurance breakdown prior to the patient's visit. First visit, number one, you don't do this, guess what? It kind of, you know, it causes a kerfuffle. It puts your operating system or workflow for the day off kilter. One of the things that we shared with you today, just because you get that fax back from the insurance company doesn't mean that you get all the information, right, that you need to be able to accurately produce a fee estimate for your patient. Mm-hmm. Knowing your exclusions limitations. Christy, I know that you can speak to this, you know, that $1,000 bridge. If you kept doing it over and over again, once again, that's $52,000 that you would have lost. Now think about it. If you did it, it's not just you, but everybody else did. That's a lot of money lost, right?
Yes.
We talked about
have a lot of upset patients too.
Right.
Well,
good job on the primary and secondary insurances, Alicia. I think it's important to know and inform our patients that we want to help maximize their benefits. But before that, you have to really be informed how both parties work, the primary and the secondary. Right. Get all that information, get that breakdown. Check for waiting periods. Don't be like me, you know, and having to have that uncomfortable conversation. I only did it one time. That's the only one time it took me, that never again. And I've taught my teams thereafter not to do the same thing. Right. So checking for waiting periods and missing tooth claws, fee schedules. Once again, there's reasons why that it's really not hard to do. It's not overwhelming. It's very easy. Hey, did you know that you can actually, there's some insurances out there that will give you your fee schedule via Excel format. You can actually ask that from them. You can, and if you're in CareStack, you can actually then upload that into the system. All right. And once again, it's important to attach the correct fee schedule to the correct insurance plan, because what happens when you don't do that, Alicia?
You're spending way too much time putting in EOBs and insurance checks because you're writing off left and right.
Exactly.
Right. I think one of the things that we didn't add on this best practices and takeaways is for our audience to inform them that, oopsies, keep yourself informed in the industry, right? I don't know what happened here. Meaning that if there are webinars for you to sign up for, get yourself educated, keep yourself up to date, anything that you can do to get your hands on. I know that Teresa Duncan is one of our favorite people in the industry. She's got a great website plus a great book, if you will. But keep yourself informed, keep yourself updated, and ask the questions from the insurance companies. I know that you don't like to be on the phone. I know that there's a lot of stuff that you do every day, each day. I've been there and done that. But once again, there are benefits for checking benefits, okay? This is how you can get connected with our panelists. There's Alicia Gerard, Christy, Crystal, myself. Once again, we also have practiceheroes.com, practiceheroes@carestack.com.